Fresh warnings this week from health officials in Ontario after a bat captured in Windsor tested positive for rabies. The virus is rare, but it can be deadly for humans. CTV's medical expert, Dr. Marla, joins me with more this morning. Good morning, Dr. Marla. First of all, what are rabies and what do the symptoms look like?
So when we think about rabies worldwide, we still see tens of thousands of deaths. 40% of them are in children under the age of 5. And that's because rabies has now moved less from domesticated pets, more to wild animals, because people are fairly good about vaccinating. So if you look at bats and raccoons and foxes and skunks, those are the most common wildlife carriers that we see. And those deaths that I mentioned are really concerning. But typically it comes either from a dog bite or a scratch. That's most of the cases that we see. And by the time you develop symptoms, which can have a long incubation period, we typically think of it as being almost 100% mortality. There's two types of rabies. The names are furious and paralytic, and furious is exactly what it sounds like. Hyperactivity, excitable behavior, hallucinations. You begin to lose your coordination. Interestingly enough, you're afraid of water, you're afraid of air. You can really see this change in behavior. And when you begin to see those advanced symptoms, death is inevitable, and it's usually a rapid cardiorespiratory arrest. In other words, your heart stops, your lungs starts. Paralytic rabies, that's far fewer of the cases, about 20%, sort of less drama. It usually starts with paralysis at the site of the scratch or the site of the bite, but then coma slowly develops and death occurs. So the bottom line is that if you think you've been in contact with a rabid animal, it becomes critical for you to seek medical attention and not to sit and wait to see if you develop symptoms. By the time you do, we have none or very little treatment. There's been a couple of survivors, but typically we think of this as being fatal.
This is awful.
It is awful.
Is there any way we can protect ourselves against it?
So firstly, common sense in talking to your children about pets, strays, and animals is very important. Making sure that you don't attract these animals to your own home. So for example, garbage cans that constantly get turned over, or if you leave exposed garbage, those are the type of things. You want to keep your pets away from wild or stray. If you see animals having a war between themselves, don't use your body to try and break up that animal fight. You don't want to go there. You want to teach your children about animal safety, and if you do have an animal, rabies vaccinations for that animal really are mandatory when we think about home cats, home dogs, that type of thing. So you don't want to go anywhere near unfamiliar animals because most of the rabies that we see is no longer domestic. So you have to do your job as a pet owner, but you have to educate your children about pets that are stray or pets that are wild or animals of any type that are wild. So it's really about education.
What about vaccines?
So vaccines are important to know. So if you're someone who's working with rabies or in a high endemic area, there's something called pre-exposure prophylaxis. In other words, we vaccinate you before, but that's really for someone who's in a high-risk occupation, or for example, if you're traveling in an area of the world where we know that there are a lot of rabid animals and you're going to be there for a month or more, we talk about giving you rabies vaccines. But as far as North America is concerned, it's mostly post-exposure prophylaxis. So in other words, you've been in contact, we're concerned that you may have had an exposure. It really is an emergency response to getting the vaccine and making sure the wound is irrigated and treated properly. So we don't think about rabies as a routine vaccine for us at all. It may be a travel vaccine in very specific conditions, but we really think about post-exposure. So if you've had an exposure, you definitely want to get urgent care. You want to speak to your local public health officer to find out what is the rabies background in the environment that I'm in. Is it likely or is it possible I could have been exposed? Because typically we cannot find these animals, right? If it's a stray,
right,
that has put you at risk.
Dr. Marla, thanks so much. Really important information this morning.
Most important, I want to leave you with talking to your kids more than anything about being safe around pets in the wild.
Okay. Good to see you this morning. Thanks, Marla.